All right, so next we're going to talk about sort of detection and treatment. And so the first thing to consider is, how do we know there's a problem? So one of the ways that we can do that is with fecal egg counts. And we like to talk about, so there's qualitative and quantitative. And quantitative is where we actually measure the number of eggs in a certain amount of fecal material. And so this is a measure of the number of adult parasites in a goat or sheep population. One of the challenges with this is that there is remember we talked a little bit about resistance. There can be a lot of animal-to-animal variation. And there's also variation due to timing of sampling. So if you're sampling animals at this time of year and trying to make any sense of fecal egg counts, it's probably not that useful because those animals probably are not on pasture, or probably are not on pasture, so they're not picking up worms. So they're probably at the very beginning of their parasite burden for the summer. So, you know, we like to do fecal egg counts as veterinarians. So I would suggest that you work with your veterinarian to develop a sampling protocol that is specific to your farm. That's something that's really important, is that every farm, every herd, every flock, every management system is a little different in how they manage their animals and how they manage their pastures. And so we are very happy to try to tailor our systems to you. And then this little graphic on the right here is just demonstrating the value, or the potential value, of taking fecal egg counts throughout the year, because that can tell you some things too. So, and this is a flock that wasn't deworming, and so they're just trying to look and see what those fecal egg counts are doing over time. And you can see that in the second column here, we have eggs per gram in June, and then eggs per gram in July. And some animals, the eggs per gram is going way up. So like this lamb 110, that's an animal that doesn't have a lot of resilience when it comes to worm burden. And then we have, for example, number 95 here. Ooh, not 95, we'll go down to 75, who had 150 eggs per gram in June, and then it actually went down in July, when you can imagine that the burden on pasture is probably going up. So that might be an animal that has some genetic resistance. So that might be an animal, again, that you would want to keep in your flock as a replacement. Another important concept, so many important concepts. Another one is that this idea that about 70% of the parasites are in 30% of the animals. So this is a big reason why we don't want to deworm the whole flock or the whole herd anymore, is because we really want to concentrate on the animals that really need to be dewormed. And so how do we do that? We use a bunch of things that relate to the physical condition of the animal. One of those things is Famacha scoring, which we'll go through in the next couple of slides. Diarrhea scoring, so does the animal have diarrhea? We can look at weight gain or weight loss over time. And then hyperproteinemia, which we'll talk a little bit more in depth about. So we want to ask the question, does this buck need to be dewormed, by looking at him? So Famacha scoring, so this is a system that was developed in South Africa, and it's a 5-point color-coded scoring system, and it uses color by looking at, this isn't actually a great picture, this is a llama, but we're looking at the eyelid, and we're looking at the color of the membranes, the conjunctiva of the eye, and we're comparing that to the color card, and we're saying, what does the color of the mucous membrane look like compared to the color of the card? And so there have been some very diligent scientists who have correlated the color with the amount of red blood cells that are circulating in the blood. So it's a test of anemia, or a test for Homunculus contortus. And so then what we do is we look at a bunch of animals and we say, okay, what is the color of the card as it relates to the color of the eye? Is she red, which would be good, or is she white, which would be quite bad? And typically we have this cutoff between a 3 and a 4. And we can use this information to determine which animals we deworm and which animals we leave alone. It's worth noting that so working with your veterinarian, you yourself can get a Famacha card, or you can go to the University of Rhode Island website and do their online certification and get certified, get a Famacha card, and start using it in your herd or flock. So that's Famacha scoring. What about other ways that we can look at animals and determine something about them? So we have DAG scoring. So this was developed in Australia, mostly to determine which animals might need some intervention. And so again, a test of soiling, a test of diarrhea. We think about this is not necessarily homunculus, but those other two roundworms that we would be concerned about. And so typically we would say 0s, 1s, and 2s are okay, but if we're getting that scouring that's kind of running down the back legs, that would be an animal that we would want to treat. And then, of course, body condition scoring, always important. So this is the University of Kentucky. This is their beautiful body condition scoring for sheep and goats card. And in general, so this is a measure of subcutaneous fat in the animal. And remember those worms that are affecting digestion, those animals are potentially going to lose some weight. And so again, body condition scoring, we want those animals to be sitting right about average. And that's pretty much true for any time in the production cycle. Certainly we might have animals that are late lactation, that we might have a little less condition on. But certainly we want to keep them right around a 3. Another consideration is using body weight or body weight gain or loss as an indicator, because sometimes it's when animals, this is also true with diarrhea, when animals have really bad diarrhea or if they're really, really skinny, it might actually be too late. So I think one of the best investments that a producer can make is in a scale. And this is useful for tracking things like average daily gain in your market animals. It can also tell you things about worm burden. So if your lambs or kids aren't quite growing like they did last year, one thing that might be impeding them from growing are parasites. And so again, getting a scale, running animals over it, and using it, monitoring animals over time is a really useful thing to do. And then this idea of protein loss. So remember, worms feed on protein. And so what happens here is that when the protein levels drop really low, fluid that's normally in your blood vessels, in your lymphatic systems, it leaks out into other places. One of those places is under the skin. And then it accumulates kind of in dependent regions. So one of those regions is in the throat region. So the sheep and this goat both kind of have evidence of that. And this is mostly associated, it's associated with homunculus, it's associated with the other two worms. And usually when animals get to this point, they don't have a good prognosis. So this is another tool that we can look at an animal and we can say, okay, she's got protein loss. This might be an animal actually that we might cull, or we might treat really, really aggressively. Okay, so moving on to targeted treatment. So there's kind of two concepts here. One is doing targeted treatment at the group level. And so this is when we treat the group only when the group needs it. And so when would that be? So there's a couple times when we can think about. So dose prior to kidding, perhaps, and this is certainly contingent on whether or not they're going to go out to pasture or whether they're in indoor housing with their kids. Kids or ewes, kids or lambs at midsummer. So we could do a fecal egg count in kind of mid-July to determine burden. We can monitor throughout the grazing season and then after treatment, so we could do a fecal egg count perhaps every 4 to 6 weeks and then say, okay, when burdens are rising, we're going to deworm everyone. Or we could monitor according to farm history. So based on what you've done in the past, what the weather is this year, what it was last year, and what kind of things maybe you're not using as a pasture that you know is dirty or contaminated. And then kind of questionable times to treat or monitor are late fall. So unless so fecal egg counts aren't a great representation of worm burden in the fall. Remember, those worms are smart. They're not progressing to adults and shedding eggs. They're insisting in the animal and waiting until conditions are favorable in the spring. So that's not going to be a great time. And then breeding animals that like housing or pre-breeding, that's also not a great time to be deworming. So then the second way we can think about targeted treatment is when we think about treating at the individual animal level. And this is when we treat animals only when we know that they will require it or that they'll benefit from it. And so this is when you wanna work with your herd veterinarian to kind of come up with the criteria that you're going to use to decide whether or not you're gonna treat an individual animal. And the reason that we're doing this, so we're trying to promote this idea called, fancy word called refugia, which basically just means susceptible worms. So we want to keep a certain number of worms, both in the pasture, in the environment, and in the animals that are going to be, we're going to be able to kill them. They're going to be susceptible to those anthelmintic treatments. And this is really the preferred method to prevent resistance. So that's the big thing that we worry about when we talk about worms, is that we want our dewormers, we want our treatments to work. And so we want to only treat animals, individual animals that require treatment. And so what's an example of this? So again, you would want to work with your veterinarian to come up with a plan that works in your system on your flock or herd. But for example, we might decide that we're going to start in late June, based on the weather, based on when your animals are going out to pasture. We're going to start evaluating animals every 3 weeks. So we're going to start June 30th. We're going to Famacha score everyone. 3 weeks later, we're going to Famacha score everyone again. And we're going to come up with some decision criteria. And so that might be this. So if your animals are in category 1 or 2, or are on the right-hand side, so they're either like white, pink, or white, they don't get dewormed. So again, we want some proportion of the animals in a herd or flock to not get dewormed. Maybe animals that are category 4 and 5, so they're super white, will always get dewormed. Sorry, I think I misspoke. So categories go from the left-hand side, we go 1, 2, 3, 4, 5. So 1 is very red and 5 is very pale. I misspoke there about animals in category 1 or 2. We definitely want to deworm animals if they're pale. And then sort of this 3 box, these category 3 animals, those are situational animals. So certainly if we have lambs or kids that are 3s, we would want to deworm them. We have pregnant or lactating does or ewes that are in that kind of nebulous zone. If we have animals that are category 3 and have a low body condition score, or if there's any other evidence of kind of poor doing, so maybe they have diarrhea, they have a poor coat, if they're a goat. So again, this is just an example plan. I'm not saying that this is what you should go out there and do, but this is a plan that that could work on a given herd or flock. Along with this, good record keeping is really important, especially when we start to think about animals that we might need to cull. We want to know which animals aren't responding to our treatments. And then again, our goal is to keep about 30% of the herd or flock untreated at a minimum. All right, so on to dewormers or drenches. So when we think about this, we think about 3 families of drugs. So we have the benzimidazoles. So these are what we would call the white wormers. Fenbendazole is probably the most famous of the benzimidazoles, so that's Safeguard. And then albendazole, which is valvazen, is a treatment that's actually labeled for liver flukes. So that's typically what people are using that for. So those are the white wormers. Then we have the macrocyclic lactone. So these are the ivermectins. So we have ivermectin, and then we have moxidectin, which you can kind of think about moxidectin as like ivermectin squared. It's a more potent drug. And then we have the nicotinic agonists. So these are the yellow dewormers, and the most commonly used one there is levamisole or Prohibit. And it's important to note, so the 4 drugs that are there in gray, those are all either porons, so eprinomectin and dormectin are porons, and marantil and parantil are available in feed additive form, and those are not preferred. We prefer to be giving oral drenches of dewormers, and that's over injectable and over porons. And the reason for that is we want to, when we think about injecting some ivermectin into an animal, there's the possibility that we're gonna have a low, we're gonna hit the worms, but then we're gonna have like a persistent low dose of dewormer. And that is a perfect breeding ground for resistance. The same thing goes with porons. It's hard to be precise when we're talking about administering a poron, so we might be underdosing, and the same thing happens. We're going to underdose, we're not going to kill all the worms, and then we're going to have some that develop resistance over time. Another important thing to note is that fenbendazole is the only drug here that is labeled for goats. Albendazole, ivermectin, moxidectin, and levamisole are all labeled for sheep. And so when we think about that, we need to really consider withholding times for both meat and milk. And this is an instance where you would want to work with your veterinarian to develop those withholding times. Other important things, so like I mentioned, albendazole is labeled for flukes. Another really important thing about albendazole is that we don't want to give it to breeding animals or animals in the first 30 days of gestation, because it can cause early embryonic death. So again, moxidectin, this is not a drug. This is kind of like a big gun antibiotic that we would reserve for human use over animal use. Same idea here. We want to reserve moxidectin as kind of a top shelf drug if all else fails. So we want to kind of reserve, keep that on the shelf and use the other options that we have. And then an important note about levamisole is that dosing it at the appropriate dose is very, very important, because there's a very small margin of safety. And if we overdose animals, they can actually, it can actually be toxic for them. So it's really important to have accurate body weights and accurate dosing information. Other important things when we think about dewormers are classes. So if we develop resistance in a class, so say we develop resistance to fenbendazole in our herd, it's very likely that albendazole will also not work as well. So if we're encountering resistance, we probably want to switch classes. We don't want to switch dewormers within a class. Very, very important concept. So what about best practices for administering oral dewormers? So like I said, I think a scale is probably just the best investment that you can make for so many reasons. But a scale will ensure that we are dosing at the right dose for the weight of our animals. And so again, wormx.info, you can go on there and get dewormer charts by weight for both sheep and goats. Which is really important, because the doses that are on the bottle aren't always the dose that is effective in our small ruminant species. So for example, goats, fenbendazole, it's labeled at half the dose that we would actually want to give our goats. Goats just metabolize things a little bit faster than sheep do. Another important thing is to make sure that we're drenching them appropriately. So to make sure that we're getting that dosing syringe all the way behind the torus linguae, or the little lump in their tongue. So I want to get behind that into their pharynx so that they swallow. We want to make sure that we're adhering to our meat and milk withholding times. And then another thing that can impact efficacy is holding goats off feed for 12 hours prior to administration. So this is especially works for benzimidazoles, for fenbendazole. So if we hold, or if we pull feed at night, come through in the morning, weigh everyone, deworm everyone, that's going to enhance the efficacy of that dewormer. So now we come to the question, what if my dewormer doesn't work? So when we think about this, there are really three possibilities. So the first one is that we have a drench failure. So we used the wrong anthelmintic, we had an inaccurate body weight, we had an inaccurate dose. One thing that you need to check is that your drench gun is actually calibrated. So the way that you can do this, because sometimes you're not giving what you think you are. And so one way that you can measure that is you can draw up the dose that you think you're giving, take a syringe, put your finger on the end of it, push the dosing gun into that syringe so you can actually tell and make sure that if you think you're giving 20 mils to an animal, you're actually giving 20 and not 15. And then incorrect route, that doesn't happen as much, especially when we're orally drenching. Reinfection. So this would be if we would deworm and then we would immediately put those animals on a dirty pasture so they reinfect themselves. And then maybe we have resistance. And so that is the third reason why our dewormer might not work. So anthelmintic resistance is a challenge. It's inevitable. It's really well documented in warmer climates, especially in the Southeast, in the Mid-Atlantic region. It certainly varies based on breed, geographic region, and farm management, what your animals are doing. And it's affected by your pasture and your dewormer management. And worm genetics. So naturally, just like us, every time we create a new human, we have genetic changes. And so that's the exact same thing that happens in the worms. So that actually happens naturally without any pressure from deworming. So that's really important to consider, that resistance will happen over time, regardless of whether we're putting dewormers into animals. And then this picture on the right reminds me that if you have guard llamas or mostly guard llamas, make sure that you're monitoring them too, that you're putting your hands on them, checking their body condition, looking at their Famacha scores to make sure that they're not kind of the typhoid Mary in your herd. Okay, so what factors other than genetic speed resistance? So these are kind of the same things that are leading to drench failure, or some of these things. So frequent whole herd deworming. So if we're deworming our animals more than 3 times a year, we probably don't need to be on the whole herd level. If we're rotating our dewormers, so that would mean switching classes more frequently than yearly, that could speed resistance. Again, miscalculations of body weight. If we're treating and immediately moving to a new pasture, we're treating all animals regardless of whether or not they need it, and then the use of injectable and poron. So these can all speed up anthelmintic resistance. And we can test for it. So I just want to make you aware, talk to your veterinarians, but we can test for resistance. And there's 2 ways. One is we can do a fecal egg count reduction test. So that's where we deworm some groups of animals with different deworming classes. We take a fecal, and then 10 to 14 days later, we come back and retake that fecal, and then we measure what reduction we have in egg burden. And that really can be repeated, every 2 to 3 years. That can give us some idea of what wormers will be effective in your herd or flock. And then there's the fancy larval development assay. So that's where we take a representative sample from your herd or flock. We send it to Georgia. They actually hatch the worms, they speciate them, and then they put them in little vials and subject them to different dewormers and determine at what dose the worms or the larvae die. So that can give you lots of useful information. It's expensive. It costs about $500. But there are more and more people who are dealing with resistance who are investing in this test as a way to determine what wormers will work on their flock. All right, so I know that some of you are potentially organic producers, or perhaps you don't want to use a lot of dewormers. So what about alternatives? And so there are a couple that I'm going to talk about. One is these copper oxide wire particles. And so this is a treatment. So we put basically some copper in a little bolus, and then we give it to the sheep or the goat. And it reduces fecal count. So we don't really know how it works. The copper kind of sits in the abomasum, and it might be slow release. It's killing the adults. It seems to be effective in growing animals. This is a great option for market animals that are going to go out on pasture. The only problem, or the challenge, or the caution is that copper toxicity is a real concern when we're thinking about this. Especially if you're using this in replacement animals. And so it's really important to closely monitor both your dietary copper levels and then your liver copper levels, because what happens with liver toxicity, or with copper toxicity, is that copper accumulates in the liver over time. And so the blood levels don't really change. So that's not usually a great indicator of whether we're going to run into copper toxicity. So that is just a caution that we don't want to be giving copper boluses more than every 4 to 6 months. And we want to really pay attention to copper levels in our flock or our herd. All right. Alternative number 2, so Serratia, or tannin-containing forages. There is some data behind Serratia. And so Serratia reduces parasite burden in sheep and goats, and the animals that are consuming this forage, they shed fewer eggs if they're infected, and something is happening to the worms, and there's reduced hatch. And so no one really knows why it works, whether the tannin is really reacting directly with the adult worm, or Serratia has some bypass protein, so is it boosting the immune system? So this can be grazed. However, Serratia is a noxious weed in some states, an invasive weed in some states. So caution there. Don't want to be spreading that throughout the countryside. But it also can be fed in hay or pelleted form and works just as well. So that's an alternative option. Another this is so cool. So this is a nematode trapping fungus. So Dudingtonia flagrans, or the fungus among us, you can go to that website and read all about it. Developed in Australia, but is newly available in the United States. And so what this does, so it has no effect on adults, but what it does, it's a pass-through. So you feed it to goat or sheep, and it comes out in the manure. And then when the larvae hatch, the fungus traps the larvae, so it can't go anywhere. It can't go up to the top of the grass. So we actually can see reductions in pasture infectiveness by 50 to 80%. And it's not the cheapest thing to be feeding your animals, but it has some promise. So I think that is worth something that's worth thinking about for your herd or flock. And then what about other alternatives? So tobacco or nicotine, those beautiful tobacco fields there in the corner. So there's a really low margin of safety there for nicotine. Diatomaceous earth has no effect. There have been some studies that have shown that it doesn't do anything. What about herbal dewormers? So garlic, ginger, wormwood, tansy, papaya seed, pumpkin seed. These are the wormers, or the herbal treatments that have some data behind them. And there's really no great data to support their use. So I think when thinking about these alternatives, or trying to think about herbal treatments, really focusing on diet, pasture management, and targeted therapy are probably the most important first step, rather than relying on any herbal treatments. All right, we're flying. So these are some cute boar goats that we take our students to go see. Okay.